Um, my background is as a medical scientist, as we talked about. I always kind of describe myself as confused because I was once a chemist, but now I'm probably more a bioengineer or something else as a background. And Sergey's done such a great job of introducing a lot of the sensing technology that I want to kind of take this and talk about something that Vicky mentioned quite early on in this, that we want to look at specific areas or themes or areas where we can start to apply future blood testing. And I want to take that based on some of the work that we are already doing in our group and more widely with collaborators funded by the EPSRC and looking at patient-specific therapies within a manufacturing sense, and then how continuous blood processing can fit into that. And I want to specifically target and think about the opportunities and some of the challenges that we should be thinking about when we're looking at these kind of moving forward in the next 5, 10, 20 years, in my views. So Vicky started off and gave us our lovely kind of overview of things. I want to talk about a broader picture of how I think personalized therapies fit within this and fit within blood testing. So we start, as always, with the patient. And that patient we want, as we've talked about, we want some continuous health monitoring, or at least regular health monitoring and testing. We want that to then fit into some kind of data analytics, either near body or in the cloud. Potentially that has some kind of interaction with your healthcare practitioner in some kind of feedback loop. And also potentially there's also a feedback loop between the healthcare practitioner and the patient in what's going on. So this is all very much sitting in exactly what the core of our Network Plus sits in and why I'm interested. But the thing I'd like to take it onto is if we can then have direct feedback of that into a therapeutic treatment, which is manufactured on the body, so that we're actually manufacturing a therapy in response to that testing on the body in response to the patient's needs, and then feeding that back into the patient on the end. So I want to start off by concentrating a little bit on this and talking about that, but then talking about how I see what the requirements are for blood testing, because I see this as the future of healthcare in the future. We have wearable devices or near body devices or at-home devices that can deliver a lot of what we need. And so how we need a blood testing system to fit into that. The model I want to talk about, and I don't want to spend too long, is CAR T-cell therapies and the therapeutic manufacturing process. This is well established. I mean, these new approaches to therapies, particularly T-cell therapies, are an emerging field. There's a significant amount of research across the physical and biological medical sciences in order to try and prove these. It's already in use. If anyone doesn't know about these, I strongly recommend the BBC documentary called War in the Blood, which is fantastic, talking about the first usage of this, of the first CAR T-cell therapy in the UK. And it's truly considered by doctors to be a cure for certain types of cancer. And it works by essentially taking our T cells, which are white blood cells, a specific type of white blood cell that we have in our blood, and then giving it some, expressing various things on the outside in order to make it target cancer cells, so that we can then use our body's own white blood cells to target those cancerous cells and then eventually kill them. The manufacturing process and for making these is incredibly complex. In terms of, but actually I want to reflect on it a little bit, because I think we have the same challenges when we're talking about blood processing for at-home usage. So at the moment, you take for making one of these T-cell therapies, you take the blood from your patient, you have to go through some various processing steps, so leukapheresis for separating bits of it, then selecting specific cells you want, then you need to preserve them in some way. And at the moment, they're then frozen down and transported to where the manufacturing site, when they go. So they're sent away from the patient, then they're selected, enriched, and activated, which are biological processes we've talked about in order to make them express the right things on these white blood cells in order to target. They're then grown in significant numbers, expanded, preserved again, so frozen again, and then returned to the patient, tested, and there's testing throughout this and return to the patient. So this is an incredibly complex process, and what we're talking about isn't that complex, but it's a starting point to now think about that a little bit. But what we're trying to do is make this much simpler, because this is expensive and takes a long time. So we're actually trying to take this into a much simpler process, and this is our approach, where everything occurs on the body, so there's no processing. We have processing on the body. We have selection and enrichment and then transferring and then back onto the body, all continuously on the body without any problems, controlled by a central process. Now, this is great, and this fits nicely into that image I've talked about, because suddenly we're able to take the body's own resources and use them to fight potential cancers. And this is ongoing work that we have on the OMS project that I was talking about, which has just come to the end, and we've got a number of avenues we're exploring to continue that work. But where this fits very nicely here as really where I see the future of healthcare, that we truly have this on-body or near-body wearable responsive manufacturing of the therapy that we need. But in order for that to happen, we need to have that continuous health monitoring, and we need to have that data analytics on the near-body or in-cloud analytics. It's a very core themes of what this Network Plus is in particular, and what we're interested in. And for all of this to happen, we particularly need to be able to think about remote blood sensing. And I've borrowed Sergei's brilliant slide that he's talked about, but now I want to talk about this in the context of what I've just talked about. So the future of therapeutic manufacturing and these kind of fully on-body or wearable devices. So we want something where we can collect the samples remotely, preferably on the body, and be able to do remote analysis and send the results to the patient. And we ideally want it something that's wearable. In order to achieve all of those things, in my view, and where we see the technology is going, and there's so much work in this, and I'm not doing it the justice within the short 8 minutes that I'm trying to keep this talk to, but the key areas that we want to do is using continuous flow-based selection or flow-based processes to look at it. Because what we don't want is to be able to take all of this out, or we don't want anything in a static thing. If we could continuously monitor what's going on inside the body or inside the blood, then that allows us to have a lot more, either a body worn or integrated implantable device that we have. And there's lots of work using flow-based techniques based on the compressibility of whatever we're trying to separate from blood. So that could be the compressibility of the white blood cells or red blood cells that we're trying to separate, down to actually using surface interactions to modify that. There's some fantastic ongoing bits of work, and I'm presenting here one example where we use the separation to flow and separate about different things based on their compressibility. An even nicer piece of work is some recent work using taking whole blood and transferring it and taking what I like to call a kind of racetrack for blood cells, take it down and separate different parts, and take your kind of white blood cells and separate them from your red blood cells and various other things based on an interaction under flow with multiple pillars. Now, these are great and these work brilliantly in a lab, but if we start to try and think about how to translate these into the real world and taking this into blood testing that we want to take in the real world, it presents a significant number of problems and challenges. This is great for being able to have portable or remote sensing or separation, because one of our biggest challenges is starting with blood and knowing what to do with it. But I want to spend the last couple of minutes talking about where I see the challenges are for this, for a continuous flow-based kind of testing and continuous testing in any form, even if it isn't under flow, and where potential opportunities for us to work. So the challenges I've split into two parts. I've talking about blood processing, and then I'll then talk about the sensing challenges, so the second stage. So for me, blood processing is actually how we deal with this whole blood and what we do in that processing. So we talked about, if we go back to it, this is when you take a blood draw, you've got your early stages, you've got your leukapheresis, you've got whatever you're doing in your very early stage, and how we manage that, but in an in-home setting in order to remove the complexities of blood. So we need to be able to separate parts of a complex fluid, i.e. blood, in a continuous manner, because blood is complex. It has lots of issues and things within it. Or we need a highly selective and sensitive sensing platform. Now, Sergei presented some of the current and the kind of emerging forms of those things, but in many cases, most of those sensing platforms aren't particularly great when you have a very low concentration of the analyte that you've got, or particularly when you're then trying to look at that in a complex fluid, which is blood, which is very difficult to look at because there's so much noise within your system and so much uncertainty. There's not even the reproducibility and the consistency within one blood draw to the next makes it very complex. So we need to be able to allow for those and adapt for those moving into the future. If we've got something where we've got a device that we're flowing through, we need to be able to control the flow during that device, and we need to be able to do that in a lightweight and reproducible manner. So we want something that will be able to flow through it, but you don't need significant pumps. You don't want to have any of those things on a wearable device or even a home device in particular. You want something that can be done in a relatively low energy and reproducible manner. we're talking about blood. So the first thing we often think about is this issue with clotting. The minute you're putting these through any of these devices, you're going to end up with fouling within the device and doing that. And ideally, you want to do that without throwing in an additive. So you don't want to do that without either removing your clotting agents or throwing something in there to stop it clotting. Because if we want it in a continuous blood flow type environment, we also want it to be non-contaminating, so that if it's wearable, for example, we can return all the blood that we've removed back to the patient in a continuous manner, allowing us to monitor in particular things in real time as opposed to taking multiple samples. So there's a much longer list. I could talk about those, but for these are the primary immediate challenges for blood processing that I see, to put it onto a continuous manner and into the future on a continuous manner, and monitoring in home as well. The sensing challenges, Sergey's introduced them so well and talked about some of all of them. We obviously need selectivity and sensitivity in order to be precise. We work very closely on some of the things that Sergey's talked about. MIPS are very much one of the future. So these molecular imprinted polymers are very much one of the future directions for giving these selectivity and sensitivity. But you also want it reproducible. And ideally, if we're looking at the progress of a disease or progress of some kind of thing, or even the response of the body to a drug treatment or any of these things, you also want it to be reproducible, but also quantifiable. We actually want to monitor, how is this changing? Is it increasing? Is it decreasing in a way that's controlled? And that's often more complex in sensing environments, where often it's presumptive testing, or you're actually being able to quantify how much is left. We want it to be able to work under a flow-based environment, particularly if we're using it in something that is continuously flowing in one way. And problems with current sensing technologies, particularly surface sensing technologies, as they are sensitive to shear. So we have something flowing, a liquid flowing over the top, you either get decoupling, or you end up with kind of destroying the sample in some way when you're flowing it through there. I mean, flow is used as a technique for actually inserting things into cells. So we have to have something that works, is able to process in high volume, but actually is not sensitive and doesn't cause shear issues. We want it to be robust and reusable as much as possible. And particularly for me, reusable is the key point here, because what we don't want is a presumptive test, which is once you've detected it, it's gone and we have to replace. And ideally, we want something that's continuous. To borrow again Sergey's brilliant image that he used around kind of biosensors and introduce them. The problem with this, no matter in your sensitive element, whatever you've got, once you've got that binding, often that's a non-reversible process. So it's your antibody binding or whatever, your artificial receptor or whatever you've got, that's non-reversible. So that's great, you can detect and you can get your presumptive test to identify it now. But if you want something that's continuously monitoring blood, or something which isn't going to increase a large amount of waste, you ideally want something that is easily, and particularly in a patient's home, you maybe don't want something where they have to be able to constantly replacing parts or something like that all the time. So we want something, therefore, that is robust and ideally reusable. So potentially sensing where you don't have those kind of biochemical interactions, or they're reversible. And finally, to lead this, I hope, nicely into what Mark is going to talk to us about, we want this something that integrates easily to data systems and all the analytics to feed onto the other end and the other half of this Network Plus, where you actually make some decisions based on these data and what we do with them. So that's a very brief summary for me. That's the standard slide at the end, and also my details on the right-hand side there, if anyone would like to get in contact with me or have a chat about any of those things. That's it from me. Thank you very much.